80% of the people that we see as nurses in the hospital shouldn't have ended up there in the first place. Think about that. Think about when we then begin to implement nurse coaching at mass scale to keep even just a fraction of those people out of the hospital, what that means.
Welcome back, nurses and nurse coaches. What's up, Heather? Welcome to today's episode. Today we are talking about why
nurse coaching matters.
Why nurse coaching? 100%. And there are so many different ways to approach this, but yeah, I think from a higher level, we're really going to look at why this matters for our patients, why this matters for our profession, why this matters for us as individuals, and maybe even why this matters for us as a planet.
Ooh,
yeah.
nice.
We'll be cruising, meandering a little bit. And really the intention here is to start with why, because I think that's really, really important.
Yeah, and I think we forget to do that a lot of times. And so we'll jump into anything new in life and we'll focus on, the specific benefit, the specific outcome, specific goal that we have in mind. And then sometimes we're not successful because we've forgotten to connect it with that deeper meaning, with that deeper understanding of why this is really so important. And I think you and I have gotten to get a deeper and deeper understanding of why nurse coaching is so important over years. It's been like half a decade in us fully understanding why nurse coaching is so important.
Heck yeah. So should we start with why nurse coaching matters to you?
Nurse coaching matters to me because it literally, I think, saved my life in a lot of ways. It saved my life as a nurse because I had gotten to the point where I was ready to not be a nurse anymore, even though I had no idea what would then be next or what would become of me as a professional. And it gave me so much more meaning and purpose and direction. So I think as a professional, it really did save my life or at least my career. But I had also gotten to a point that so many nurses are at of such burnout and longing for something to be different that it also saved my well-being because it gave me a way to focus on myself and my health and my life while building a profession that really inspired me. That's what comes to mind first. I've got a whole lot more stuff floating around in here, but what do you think?
I think that's a good start.
Yeah.
And I think, as individuals, for each of us, nurse coaching matters differently to each of us. For every nurse coach out there, it has a different sense of meaning because there's so many different ways to implement this work. So maybe it's important to kind of zoom out and start first with, why nurse coaching matters to our patients. Want to drop some stats? Should I drop some stats?
Drop some stats. Be the stat man.
Yeah. When we're looking at the well-being of our patients, what are some of the numbers that are flying around out there? So about 2/3 of our population is on one or more prescription medication. 2/3. That's hundreds of millions of people are on one or more prescription medications. 2/3 of people have one or more chronic disease. So anything from high blood pressure to heart disease to diabetes, to whole gamut, right? We all know it. And 2/3. So 2/3 of people are at least one or more prescription medication. 2/3 of the population is experiencing one or more chronic diseases, which are really diseases of lifestyle. And 2/3 of people are either overweight or obese. And we're not even counting in here the vast amount of people who are suffering from mental health issues.
Right. Loneliness, depression, anxiety.
Yeah. And so I think what we've really gotten to as a population is just this really deep place of unwellness. And it's interesting because we're coupled with all of these advancements in biomedicine, pharmacology, in modern medicine. I mean, you walk into any modern hospital and you're entering into a freaking spaceship. It's crazy in there and it's super, super cool. But despite that, when you look at population health as a whole, it's not working, right? There's a complete disconnect between all of these advancements here and the actual state of well-being of our patients.
Right. I mean, in a similar way, right now we live in a time that's digitally more connected than ever before, but people are lonelier and people are more isolated. It's this incredible paradox of technological developments and advancements, but for some reason, it is not lining up with how it's actually able to positively impact us. In a lot of ways, it's actually having an inverse effect.
What's the reason?
Well, the reason is that there is a huge gap between when these technologies are useful and when they actually reach people to benefit them, to serve them. I mean, all these modern advancements that you're talking about in medicine and in technology, they are wonderful for keeping someone alive when they're on the brink of not being alive, right? Bringing someone back from the dead, working to treat symptoms,
helping
manage
with immediate symptoms. Yeah.
Right. When you are in need of acute care, emergent care, the hospital is the place to be. Let's leverage all the technology we possibly can to do you the best good at that moment. But the problem comes that where our population needs support the most is before we get to that point. It's so much before we get to that point because, as you said, 80% of these chronic diseases of lifestyle are preventable.
And in many cases, reversible. And I think that's really important to talk about because maybe 10, maybe even 15 years ago, we thought that these were actually chronic diseases. Right? Hypertension, type 2 diabetes, high cholesterol, cardiac disease, right? All of these things that we thought were irreversible diseases, now we know that through simple lifestyle modifications, simple not meaning easy, but through simple lifestyle modifications of eating more whole foods, eating, moving your body, reducing stress, having better relationships, practicing mindfulness to really restore that sense of a more calm nervous system, that has dramatic results on our well-being. And I mean, when you say that number, I think it doesn't always hit home. 80% of all of these chronic diseases, and remember, that's hundreds of millions of people suffering every single day, 80% of that can go away through the power of nurse coaching if and when it gets implemented at scale. And so when I talk about like why nurse coaching matters to our patients, it's because when we can begin to do this work at scale, which right now we are doing it huge, right? We're doing it pretty big, but it needs to be so much bigger. When we start to get there, we're going to really begin to see some of these trends reverse. And it's gotten to the point where they have to reverse, unfortunately, where we're like,
or fortunately, yeah.
Or fortunately, but there's that wake up call and people are so ready for it,
Yeah. Yeah. I mean, what that really means is 80% of the people that we see as nurses in the hospital shouldn't have ended up there in the first place. And like, think about that. Think about when we then begin to implement nurse coaching at mass scale to keep even just a fraction of those people out of the hospital, what that means for our population, what that means for our medical system, all the space that frees up. It's wild to think about. I mean, it's almost hard to wrap my mind around what that reality would really look like, even though that is the reality that we can achieve and we should all be striving for.
And I mean, when you look at like what that does, like, I remember being in the hospital and just watching that revolving door.
Yeah.
We always talk about the frequent flyers, but what I didn't realize, and what actually took me a surprisingly long time to understand, and maybe it's because I was so deep and having fun in the hustle and bustle of the ER that I didn't have a chance to zoom out, but is that it's not just the same people that come back. It's the same problems, same preventable illnesses over and over and over again. And that wears on us. That wears on us as providers. I mean, because why did we get into nursing? Why did almost every single nurse get into nursing? Is because we want to help people. We want to help people get better. But instead it feels like we are slapping pills and procedures and quick fixes on problems that need real solutions. And in this case, it's coaching. It's supporting people and empowering people to make those choices that are going to help them to become truly well. And, when we look really, it's an insane model. I mean, why is it that within 1 to 2 years, so many nurses are like, you know what? I can't even do this anymore. Like, that's craziness. Why is it that we have all of these advancements in technology and yet you have hundreds of millions of people suffering from these diseases of lifestyle? Like, something needs to give. And so I really believe that's why nurse coaching matters, is just because it's the thing. It's our path out of that darkness, out of that madness, out of that insanity, not just for our patients, but also for us nurses.
For us nurses, because nurses, I think right now, and this is only magnified in the last several years, like nurses are suffering and struggling more than the average person. And that's a result of so many different things, of working inside of this medical model that doesn't work, so that we feel trapped, we feel stuck in this box, we feel like we are providing sick care when we are just desperate to be providing wellness care. Like there's this huge feeling of being out of alignment, right, between what we want to be doing and what our role demands that we do instead. And then when you combine that professional dissatisfaction, and this is really not to hate on nursing in any way, because I don't know a single
we love nursing.
We love nursing, and I don't know a single nurse who doesn't like love being a nurse, love that identity of being a nurse. But almost every nurse I know is disheartened, is dissatisfied with their actual job and day to day in some way, shape, or form because of exactly what we're talking about, right? Because of this disconnect and the breakdown in the system and the brokenness of the system.
Yeah, and I think this goes by so many different names: burnout, compassion fatigue. I think the language that resonates with me the most, and I think the language that really describes it best, is moral injury. Because I think every single nurse gets into the profession because we want to really help people. We want to serve and support people to be well. But when our day-to-day reality of our job doesn't line up with our expectations, then we're met with just like we're always expected to do more and more with less and less. Like we're seeing this over and over again, right? With staffing issues, with more and more patients, and then less and less nurses, and more and more patients with more problems, more comorbidities, and we don't have the tools in the traditional model to really help them. And so, yeah, I really believe that nurse coaching gives us those tools. It gives us those tools to begin to reclaim some autonomy over our practice and to come back to, the heart of what it means to be a nurse.
How many times have we heard nurses telling us that like they are walking into their patient rooms and they are providing care for their patients, and the thought that they have playing over and over again in their mind is like, this isn't the way I would want to care for myself. This isn't the way that I would want to care for a family member. And I think that's where that moral piece of the moral injury comes, right? We're forced to be providing a type of care and practicing in a type of way that doesn't align with what we believe in. It doesn't align with what we want. And so that's maybe like the professional toll that it takes. But if we're really being honest about the state of health or lack thereof in our population, then I think we also have to look at the state of ill health amongst us, amongst the nursing profession as a whole, because what may or may not blow your mind, but it certainly blew my mind when I learned about it, is that nurses are more unhealthy across the board than the average American, like on all of these different spectrums, right? Everything from nutrition to exercise to levels of stress to mental and emotional health, and the things that we really suffer with outwardly or suffer with quietly. Nurses are some of the people who are struggling the most right now. And that's not just because of the broken healthcare system. That's because of, well, I guess they're all symptoms of the broken healthcare system, but it's not all just due to what our job is and isn't. It's due to how our nurses are treated, how they're supported, how they're not supported, how we treat one another. And like you said, nurse coaching gets to be the light out of that madness, because it is such a different approach to how we get to care for ourselves and how we get to care and serve and support others.
Yeah, so maybe we should talk a little bit more about why, right? So we're talking about why nurse coaching matters. We kind of hit on a lot of the points that so many of us know, the spiraling chronic illness.
Yeah, we're not telling you nurses anything new at this point. You're like, yeah, that's what I've been saying for all these years.
Correct, yeah. And I think it's important to just evaluate, look at where we are with complete honesty. And I think maybe a little bit of that is missing, and maybe a lot of that is missing. So yeah, how does nurse coaching come in? How does it come in to meet on those problems? Because what I see, right, we can zoom out and we can see, yeah, okay, healthcare is completely broken. It's a massive problem. Everything's messed up, right? Our patients are super sick. Nurses are burning out. Tons of problems, right? But what I see is possibility. And I think that's one of the greater things about nurse coaching, is that it trains us to be more optimistic and to be able to see possibility inside of, what is often a very problematic downward spiral of negativity, where we kind of just talk about everything that's wrong.
What we often do as nurses, right? Sit around and kind of, pardon me, but bitch and moan and talk about woe is me of being a nurse, because there's so much of that. And because it feels good to commiserate. It feels good to really find camaraderie in that shared suffering.
Yeah, so I think what I want to say is, or I think what we should talk about is like the value of nurse coaching in flipping the script, in being that paradigm shift, in transforming healthcare.
Well, I think, again, this is multifold because it happens on so many different levels. One that I think we've really spoken to here is the ability for nurse coaches to reach people at a different state, right? Not the state when they are desperately sick and in need of medical technology and modern medicine, but to meet them earlier on in the process so that they never have to get to that point in the first place, to help coach them around all of these different areas of their life and lifestyle, not only so that they won't end up ill or so that they can reverse disease, but so that they can take ownership and personal responsibility. It's almost like we give our patients their power back, right? Because that's what we see when people come into the hospital, is they almost show up and they are powerless because they give it away. They give it away to their doctor and they say, you tell me what my problem is and you fix me. There's no personal ownership of what can I do, what could I have done, and what can I do from this point. And that's the different approach that we take in nurse coaching. And people want it. They want it. They are desperate for it. They're hungry for it.
Paying for it.
They're paying for it.
Yeah, I would say that like $50 billion plus in the last year was spent on alternative treatments.
Right.
Out of pocket.
Right.
To be clear, that's like out of pocket, which is a lot of money.
Which is a lot of money, especially when you look at where it was at, even just 5-10 years ago. It's like up and up.
Yeah, people want to get better. They're tired of being sick and tired. And I think nurses on the whole are tired of kind of perpetuating this broken model. And so I think what so many nurse coaches find is that it's this opportunity to do things differently. And so how does that work, right? How does that work? Well, it happens at, those micro interactions. When we look at like what a system is just this sum of its parts, right? And all of these micro daily interactions that are happening between nurse and patient, each of those is an opportunity for us, nurse coach and client, nurse coach and patient, to start to change things. And I think it starts with us. It starts with us as individuals, as individual nurses deciding like, I want to do something different. Like I want to be part of that change. And nurse coaching is that opportunity, is that light, is that capacity for us to be different.
And when it comes to talking about, the well-being of us nurses, I think the thing that's so cool is that, we have nurses who are 2-3 weeks into the Nurse Coach Collective program, and already they're experiencing and they're sharing with us, I'm not feeling burnt out anymore. Like 3 years of compiling these feelings of burnout, and suddenly they're like, I see the light. I feel the hope. I'm not feeling burnt out because I have a renewed sense of optimism, a renewed sense of connection. I'm not feeling alone and disconnected because I found my people here. I feel like this is my place, my home inside of nursing. And you have this really awesome term, I think, that you're constantly coming back to this idea of the sustainable quick fix.
Sustainable quick fix. That's right.
And it's because when we talk about nurse coaching, we often say, okay, we're moving away from sick care and towards wellness care. We're moving away from the quick fixes that don't work and moving towards that ongoing human-centered, relationship-based care that actually can lead to true transformation. But when we look at the nurse coaching model and how quickly this new approach can really take root and really have impact on improving the lives of nurses and improving the lives of the patients that we get to serve, it's actually pretty quick.
It's not as long as you might think.
Yeah.
Yeah, so we've trained at this point about more than 2,000 nurse coaches, and each of them is in their practicum working with, and this is just in their training.
Right.
I'm not even talking about like their day-to-day life afterwards, but just in their training, like they have touched the lives of close to 20,000 plus individuals. And when we culminate the program, like we go back through and we read and we sift through so many of those testimonials that they got from the people that they worked with. And in just 4 to 5 sessions, like these people's lives are completely shifted in like very remarkable ways. Like diseases that were hurting them for years, decades in some instances, wanting to get off medications, wanting to be happier, wanting to be healthier. So much can shift in 4 to 5 hours of nurse coaching spread out over a few weeks. And what's interesting, why I call it a sustainable quick fix, is because that's relatively quick. In the grand scheme of things, it's not a 15-minute appointment, but that's relatively quick in being able to, help and change somebody. So
Yeah, I think actually that's an awesome idea for a future conversation, is exactly that, right? The sustainable quick fix. Let's bring in some of these testimonial stories, some of this like proof, because I think it's hard. We have so much exposure to it. We've seen it all, but I think it can be hard to actually believe the change that can take place over just 4 or 5 sessions. And that's true in terms of how much our nurses grow, but also in terms of how much the patients can really transform and elevate their lives. So that would be fun to bring in some of that proof and share it. Yeah.
I think the final thing that I really want to touch on is, and I know I touched on this, but it does bring so much legitimacy to this field. When we talk about health and wellness coaching, people are complicated. People are super complicated. And, when we talk about a population that's that sick, there's a lot of comorbidities, a lot. And so, to think that somebody could be a health coach who's not like a licensed medical professional, to me just kind of seems a little off, super off, and a little bit strange. So what I love about nurse coaching is that it empowers us nurses to be where we're supposed to be, which is leading the charge, leading the health and wellness revolution, and bringing about that wellness model. And so to me, that's like, yeah, go nursing.
Go nursing. We gotta have that be a little musical interlude. Yeah, I love that. And I think what you're not saying directly, but that we do talk about often, is that health and wellness coaching as its own industry does exist. That has nothing to do with nursing. It has nothing to do with any professional specialty. And it is adrift, and it is unregulated. And are there some amazing untrained health coaches out there using that title? Sure there are. And there are also some really untrained people that shouldn't be practicing. And so that makes it really hard for the population to know, who can I trust? Who can I hire? Who's worth my investing in? When anyone from, my mailman to my 8-year-old niece can go take a quick online course and then call themselves a health coach.
Okay.
It's crazy, because as humans, what's our most important asset? Health, right? It's our health. Yeah, it's our health, our happiness, our well-being. If we're going to trust someone, if we're going to put those things, in partnership with another person, with a coach, we want it to be with someone that we can trust.
How about with the world's most trusted?
How about with the world's most trusted profession? That's right. And so, yeah, I think that is why the establishment of nurse coaching as a specialty in nursing and the board certification to back it up with that professional legitimacy and clout just allows us to stand, as you said, exactly where we should be standing, at the forefront, and really kind of above and beyond any other health coach out there.
Boom.
Mic drop.
That's it. Say that's pretty solid episode 2.
Yes.
Anything else that's on your heart that you want to bring into this episode before we talk about what's coming next?
At the beginning of the episode, you mentioned that maybe we would talk about why this matters for the planet. And that's like kind of a big deal, kind of thinking pretty broadly.
We should save it.
We can save that. But I think the piece that I want to get at is, we've talked about this hope. We've talked about the optimism. And this is like your superpower in my mind. Your superpower is thinking big and thinking globally and not being afraid to dream of all of the good that we can do individually and collectively. And that's why, to me, nurse coaching matters for us as a planet, because of that massive good that we get to do. But I got to hear it from you, because you speak this so much better than me. But like, what is the bigger vision of this impact of nurse coaching? What is the ultimate goal of, just for example, if we could have every single nurse out there trained in the art and science of nurse coaching, every nurse becomes a board certified nurse coach. Big picture me, what would that make possible?
One sentence. It's the eradication of chronic preventable disease and nurse and provider burnout.
Yes, that's it. That's exactly what I wanted you to say, because I've heard you say that to me so many times, but I can't say it like that. Say it one more time.
Yeah, and sometimes when I get lost in the weeds, I come back to this, and this is what ultimately I really find myself working toward is nurse coaching, I believe, can be the pathway to eradicating chronic preventable diseases of lifestyle and, for the most part, eliminating nurse and provider burnout and suffering that takes place inside of our profession. So I think when those two things can happen simultaneously, and to be clear, they're happening right now. Like, it's happening right now in real time. I think it's awesome to be able to talk about that, but I think what's amazing is that it's not some pipe dream, right? It's not something that's happening 20, 30 years from now. It's happening in right now, right here. One nurse, one patient, one conversation at a time. We're doing it. Nurse coaches have infiltrated every single part of the medical system. Bedside, leadership, insurance companies. They're starting wellness clinics. They're hosting retreats. They are doing just private practices. Like, it's absolutely awesome, the work that's happening in the here and now to make that ideal vision a reality.
To make that ideal
to bring
vision
it into the present.
Not a pipe dream, not an impossibility.
No, man.
To make it actually something that we are striving for and actively creating in this moment. And I don't think we need to get into why that matters, because I think every nurse can simply close your eyes and envision a world where we can eradicate preventable chronic diseases of lifestyle, a world where nurse burnout doesn't exist and is a thing of the past because everyone is feeling so freaking fulfilled and pumped up and inspired and connected to the work that we get to do. You tell me why that is so important and why nurse coaching matters in that way.
I think what I forget is that it comes down to us, right? We can talk about all of this stuff, but we have to do it. And no one else is going to come do this for us. It's not going to be some fairy Elon Musk kind of folk coming in healthcare and being like, now I'm going to change this thing. No, it's us as individuals making that choice to change our life, to change our practice, and then it compounds from there and we all get to work together. And so, yeah, I think that's what we're going to talk about on the next episode, which is how that works, like how it works to go from nurse to world-class board-certified nurse coach in just a few months, and how you can really be the change instead of waiting for somebody else to come along and to make that change for you, how you can do that in your life as a nurse, how it's helped us, like how, when we make that choice, how it's helped the thousands of nurses that we've had the opportunity to serve when they made the choice to become nurse coaches, and what that looks like.
Yeah. So we'll talk about the Transformative Nurse Coaching Program. We'll talk about how any nurse can step into their own journey to become a nurse coach. And we'll also talk about all that's possible in this field, everything that you just alluded to of how we've infiltrated every single part of the healthcare system. We'll explore like what are nurse coaches actually doing and what is truly possible, not as a pipe dream, but as the things that are actually being done in the here and now by nurse coaches in this moment.
Heck yeah. Nurses, nurse coaches, Heather, thanks for hanging out. Lots of fun. And yeah, we'll see you in the next episode.
See you next time.